and welcome to our channel. Meet Mr. Patel, who is a patient of CKD on dialysis. He consumes nearly 12 different medications during the day. So confusing and so likely to miss out. So today we'll be talking about a very important patient safety protocol, that is medication reconciliation. This process ensures that all patients get their correct medications at all times, whether during admission, transfer or discharge. So let's dive into this topic. Polypharmacy is defined as the concurrent use of multiple medications, and it has been seen that as the CKD disease progresses, there is more and more of this happening. 85 to 90% of the patients commonly take 5 or more drugs, and up to 20 to 25% of the patients have more than 10 drugs in their prescription lists. And this also increases when the stage of the CKD progresses. So in stage 3 CKD, 50% of the patients have polypharmacy, whereas in stage 5 CKD, that is those on dialysis, nearly 80% of them have multiple medications in their prescriptions. What are the adverse effects of such polypharmacy? Well, it causes a lot of problems such as adverse effects due to the various drugs which are being taken. And CKD patients experience adverse effects 2 to 3 times more frequently than normal patients. It can cause a lot of drug-drug interactions which can lead to clinically significant complications like bleeding, hyperkalemia, hypoglycemia. And nearly 70% of the patients can experience these drug-drug interactions. And all of this, of course, leads to non-adherence towards medication, either because of the complexity of the regimens or because of the various side effects. So how do we tackle this problem? 3 ways of doing that. First of all is deprescribing. Yes, you heard that right. Reduce the number of medications to be taken, thereby reducing the pill burden. Secondly is a multidisciplinary team approach, in which every specialist will review whether his medications are to be continued, discontinued or added or replaced. And lastly, what we are going to learn today, medication reconciliation. Let's now learn how to do the medication reconciliation actually. For this, first of all, here is a small proforma that I am sharing with you. First of all, we need to include all the medicines which are taken by the patient, whether they are prescriptions, over-the-counter medications or herbal medicines, etc. We have to write these down in the table, whether they are in a liquid form or a tablet form, injectables, and so on. What is the strength, what is the route, and what is the dose? And what are the timings at which the patient is taking them? Lastly, we need to write down the indication for which this drug has been prescribed. And this is an important step because it will tell us if the indication no longer exists or if the diagnosis has changed from a provisional to a more correct diagnosis, then we may need to reduce or add some more medications. Next step is to discuss in a multidisciplinary team whether this medication needs to be prescribed further or needs to be discontinued or needs to be stepped up in its dosage. And lastly, whether the patient's own drugs are suitable for use or not. So the patient may have different brands and there may sometimes be combination in the brands that he is using, which we may not want it to be. And that's why medication reconciliation is a very important step. It's essential to involve the caregiver who is immediate so that they are updated about what we are doing. It's also convenient to ask the patient to bring his box of medicines so that we can actually pick up each pill and ask the patient, are you taking this pill? What time do you take it? What's the dose? How many of these do you take? And so on and so forth. And you may be surprised at the findings that crop up. When should it be done? At least once a month. So I hope this has helped you. If you like this video, subscribe to our channel and stay tuned for more such videos. Thank you.